Hello, how are we all? I hope you are all well. So I'm just going to jump straight into it. So welcome to episode number 8 of the live education sessions with myself, live skin education sessions, I should say, where I delve into the topic of skin and everything you need to know, whether it be sorry guys, I've got a makeshift setup today, so everything is just balancing very, very gently. I better not move too much. So on these sessions we talk all about skin, we talk about disorders, to do with skincare, just really everything within that topic. So today has been a very, very much anticipated episode talking all about acne. Now this is really just going to be scratching the surface today, as this topic really does deserves many, many videos and elaboration and way to treat and just so many details. So today I am going to start off with the basics and just kind of teach you a little bit more about acne and kind of widen your knowledge on the topic, and then we're going to delve more into it next week. So I just want to quickly say hello to whoever is watching. So hello Stephanie, hello Kai, hello Mina. Oh, Kai's excited for this one. Kai is a skin therapist who's practicing over in Tasmania, and I'm actually going to quote one of some of his article about acne throughout this broadcast. So I reckon we're just going to jump straight into it, and I will let you all know I do have a Q&A happening right at the end, so do feel welcome if you do have questions to pop them down below. Hey Stephanie. And happy to answer your questions, and let's get into it. I am looking down at my notes, so do bear with me here. And you know what guys, let's do it. So acne, hello Bianca. So acne is a terrible, terrible skin condition, and as you all know, it affects so many people, and mainly teenagers. That's where we commonly see it, but it really isn't just limited to teenagers, and we'll kind of touch on that a bit more. So it's not only, you can really see it on the face. It's very evident when someone has acne, but it's not only physically disturbing for the person, it's actually emotionally disturbing and can be a huge cause of all kinds of emotional and psychological manifestations. So it can really, really bring someone down. Now I'm not here to elaborate on that and kind of make anyone feel bad about it, because it's just hard enough having these conditions, so having these feelings about the condition. So this is why having treatment can usually be really, really effective, not only for the appearance of the skin, but for the person in general, and trying to getting them to come back to themselves. Because when your self-esteem is down, when you're feeling really low, anxiety, depression, all of that about your skin, it really beats down on your confidence. And that's probably the number one thing that really saddens me about the condition. And but it also drives me to keep on educating and really get better at my trade, because I know when I can help someone in this way, it's a really, really beautiful thing, because their whole life changes. The confidence comes back, so they're going out and spending time with friends and doing the things they love. So I did just want to start off with that and share that little tidbit, because it can be a really, really sad thing to go through. So super passionate about it, and I treat a lot of people, a lot of women and men with acne, all different kinds. So that's what we're going to go into just after I kind of talk about acne and the myths. Now, to be quite honest, I didn't want to delve too much into this, because I don't want to perpetuate any myths, just in case someone doesn't hear the whole thing. But You know, most people believe that acne is just a disorder for people with oily skin, and that is so far from the truth. Hello, Lisa. So yeah, acne isn't just for people with oily skin. It can happen to someone with the dry skin, but in particular, if you do have an oily skin, it's all to do with the free fatty acids and in the oil, and that can kind of cause havoc. But if it's in quite a dry, lipid dry skin, that has a whole host of other issues when it comes to acne. So both are affected and they kind of have to be treated differently. Acne comes from being unhygienic. No, that is so far from the truth. That is not true at all. Actually, when you're over cleaning and over cleansing and scrubbing, that's actually going to cause more of an issue for acne. So anyone can have acne, whether you're hygienic or not. And there's a common misconception, and this is kind of true and kind of not, that acne is because of a poor diet. And it's a very judgmental and stereotypical thing to say. People will like look at someone and go, oh, they must be eating terribly, no wonder they have acne. Well, I'll tell you what, from all the experience of listening to people's diets and treating this condition, it's so far from the truth. You can have an amazing diet and still be suffering from acne. You can have a disgustingly horrible diet where you're just eating fast food and you won't have acne at all. So it's not the main cause, but there is dietary links to acne. However, there isn't a lot of research to back this up, but there is enough to suggest. So we're talking things like dairy, that is definitely going to inflame your acne, high glucose, pardon me, high GI foods, absolutely. And there is a few others that tend to be a little bit aggravating to acne as well, but it doesn't always remain consistent as well. So it's about kind of finding those particular foods for particular people, because it's never consistent when it comes to the food. But definitely dairy and definitely sugar, they're both things you should really try to limit if you are suffering from acne and you're wanting to treat it. Hello Renee, thank you for tuning in. So there are different types of acne. So we're talking, so for a drier skin type, we call that acne tarda. Acne vulgaris is pretty much the condition. Then you've got different grades of acne. No, you know what, no matter the title of the acne, it still is acne. No matter if it's a very minor case where we've got maybe a few pustule, and I'm going to go into what these mean as well. So bear with me, I started using technical terms. And hello Jackie. Oh, thank you for the compliment, I appreciate it. So it really, you know, it doesn't have to be severe to be called acne. It can be very unobvious, but no matter it still is to a degree. It could just be congested skin, but most of the time, if you do have kind of breakouts and a lot of pimples on the skin, it is a grade of acne. So basically acne presents on the skin as excess keratinization or hyperproliferation of the cells. So that just means an abundance of skin cells, whether that be because they're creating too much or they're not really desquamating properly. And there are a lot of reasons for all of these. So this is what I mean about acne. We can really just keep going and go on tangents. So we've got an impaired acid mantle. I've never seen an acne client who doesn't have an impaired acid mantle. So it's actually the first thing I will treat when it comes to acne, and I'll go on to that on at another time. But essentially, if your acid mantle, which I like to refer to as the skin's roof, a lot of people refer to it like this. So the roof is protecting what's in your skin, and it's protecting things, stopping things from going in and stopping things from going out. And if you've got holes in your roof, well, things are going in and out and things are wreaking havoc, and it's a big mess. So an impaired acid mantle will also result in the pH of your skin being incorrect, so which creates a perfect breeding ground for the P. acne bacteria, which is the next one I'm going to come on to. So the P. acne bacteria, you all have it on your skin. It's there for a reason, but unfortunately when the acid mantle and other reasons imbalance, the P. acne bacteria comes to play and wreaks a bit of havoc. It actually goes into the hair follicle yeah, can cause some issues in there. So you've also got comedones on the skin. So they're more, what I just mentioned just then, they're more kind of what I would see on the skin, and these are what you would see, but these are the technical terms. So we've got comedones. So comedones is a fancy word for blackheads. So they're the kind of like widened pores with the black head on top. They're kind of a bit crusty and a little bit hard. And it's just blocked in the pore essentially. And then you've got closed comedones, which is essentially the same thing, except for we've got skin going over the top. So if you were to pop them, they would come out really thin and white, kind of zzz. Then we've got pustules and papules. So pustules are the kind that develop a really strong white head. So those ones you can really pop, and they're kind of explosive. Just to kind of give you all a heads up, that white stuff on a pimple, that isn't, it's pus. But what pus is, it's actually just dead neutrophils. So that's just a type of white blood cell that comes into the hair follicle because there's something going on, there's inflammation in the area. So that's what the pus is. It's your neutrophils. It's a part of your body, and it's their waste product essentially. So that's on the top of a pustule. And a papule is essentially the same thing as a pustule, but kind of deeper under the layer, and kind of like causes those kind of blind looking pimples. And these are all just blocked follicles, blocked pores in different manifestations essentially, and they all have their own kind of unique way of going about it. And then we've got cystic kind of nodules that are deep within the skin, so they tend to cause a bit of scar tissue as they develop. And yeah, and then after this, the aftermath, we have ice pick scarring, so those kind of holes in the skin essentially, and kind of dips into the skin. They are a little bit harder to treat, but the other manifestation of scarring is post-inflammatory hyperpigmentation, which is a disorder of pigment. So it's essentially what's left over after, and it's your skin, it's the excess pigment that's been created because of the inflammation. So there's a lot going on when it comes to acne. We've got problems with the sebum control, we've got problems with texture, and we also have problems with the color, so the pigment in the skin. So it is a multifactored thing for myself to treat and other clinicians to treat when we're looking at the appearance, because we're having to think about all these different things all at once. And yeah, I just had a mental blank. Just to give you a heads up, I'm in the Gold Coast right now, and I'm here for some more skin education training and business development stuff. And I got up very, very early this morning in Adelaide. I think it was 3:30 a.m. I got up, got ready for my flight, so I'm a little bit tired, so do bear with me if I do have these little kind of moments. It's just I'm very tired. So yeah, that's kind of the presentation. So we're talking redness on the skin. All of these breakouts, they sometimes come around the jaw, maybe they're on the forehead, maybe they're across the T-zone, down the neck, sometimes on the chest and sometimes on the back, and they will all manifest differently. And one acne from one person to the next can look so different. And yeah, as you see, I've got a fair few acne clients at the moment that I'm looking after, and as I progress with their skin transformation journey. I'm really excited to, if they give me permission of course, to share their before and after pictures, because not one has been the same. So I'm excited for you to see that, to kind of break down those ideas you might have about it. Some are more severe than others, but it really just manifests differently for other people. So acne is due to a variety of factors, and I will just kind of elaborate on all of these factors for you, but I will just say that depending on the person treating the condition, they will have a different thought on this. And I'm going to talk about this afterwards. So we're talking doctors, dermatologists, naturopaths, beauty therapists, and skin therapists. So I'm going to delve more into that, but acne, in terms of the medical industry, there's a lot of unknown. They are not fully sure why it happens, but there is a list of things that we do definitely know. Yes, so the medical industry is a little bit stumped on it, but I think it's because of just not knowing enough about the skin. So that's why skin therapists are able to get such good results generally, topically. So a combination of factors. So the health of the sebocyte. So I actually want to just quickly give a big well done to Kai. He did an article on acne, the many causes of acne, over at the business he works for, which is Mary Skincare. They're based in Tasmania. So I'm just going to read the paragraph from that because I think it just explains it so perfectly. He said it so eloquently. So depending on, so the sebocyte, basically, I just wanted to mention, is a type of cell in your skin. So depending on the health of the sebocyte, the cellular debris left over from the cells disintegration is removed by enzymes and macrophage cells. So enzymes, they're already in your cells, and macrophages, they're white blood cells, before it poses any problems. So this is a normal process. Sometimes, and even in a healthy skin, these built-in defense systems fail and cellular debris becomes mixed with the sebum, causing cutaneous blockages as the secretions move up through the narrow passageways of the hair shaft. So basically what Kai is saying is, pardon me, is basically saying that the sebum that you naturally create in your cell, in your skin cells, which is there for a very good reason, it's to protect you, and that's what's impaired when we mean an impaired acid mantle. It means it's not essentially there anymore. It is there, but it's not doing the job properly. So essentially it's meant to be cleared. It's not meant to get blocked within the hair shaft, but essentially it can, due to the enzymes not working on the macrophages, and also essential fatty acid deficiency, which I wanted to touch on. So the quality of the sebaceous gland sebum is highly dependent on essential fatty acids for improving the health of the sebocyte. So when the quality of sebum is affected by essential fatty acid deficiency, blockages of the hair follicle can occur as the sebum and cellular debris secreted literally becomes so thick and viscous and gluggy that it simply cannot migrate up through the narrow passageways of the hair shaft and onto the surface of the skin. So it's just essentially, we're just talking about the quality of the sebum. So and thank you, Kai. I love how eloquently you wrote that. So essentially, the sebum that's being produced is not a good quality. So it's a big reason is the health of the sebocyte cell. So we really need to rectify that. And the best way to rectify that quite easily is just by simply, sorry, I've got a bit of a sore throat, is just by simply supplementing with omegas. So most people in the Western world are deficient of omega-3s. We tend to get a lot of omega-6s in our diet, and omega-6s are a little bit pro-inflammatory. Inflammation is good for you in a sense, but not too much. And essentially, we tend to have a lot of omega-6s, but not so many omega-3s. So we need to usually supplement to get more omega-3s into our diet, so we're not causing inflammation in our body. We're regulating, essentially. So really simply, essential fatty acids get onto those omegas. It's probably the first step. So we're going back to some of the causes. And I promise to keep trying to use these really simple terms to explain all. There is so much when it comes to acne, and I'm really missing out a lot of that really good. I'm kind of really breaking it down today. I'm not really going into a lot of the technicalities. So the P. acne bacteria, I brought it up before. So this P. acne bacteria is it's a bacteria. It lives on your skin. We have a whole microflora of bacteria that live all over our body and inside of you. Lovely, isn't it? But essentially it has a job to do, and when your acid mantle, so the oil that's being produced, that's coming to the surface, when it's not quite there, it's impaired due to a lot of reasons. The P. acne bacteria tends to kind of overgrow and take over and start wreaking havoc. And essentially it will cause blockages and issues and inflammation on the skin. We've got poor corneocyte compaction and desquamation, so it just means your enzymes aren't working that well, your cells aren't forming correctly, they're coming up as little immature baby cells and coming to the surface not so healthy. I mentioned it before, but an impaired acid mantle and microbiome. The occlusion of the hair follicles, this might be from a lot of things. It could be to do with those blockages in the hair shaft. It could be to do with occlusive products being put on the skin. There are many, many causes of this. And then we've got genetics. Unfortunately, it really is genetic. So that is something to be reminded of. Hormones. So this is a huge, huge part, but isn't always to do with hormones as well. So we have hormonal mediated acne, and then some acnes just really aren't. They don't have a hormonal link. There is obviously a small hormonal links, but we might be able to correct them topically in the skin. So hormones, yes, it's a huge thing, and I obviously can't treat your hormones. I can only give you lifestyle advice. Your doctor is the best person to speak about all of this, but I'm going to kind of talk a little bit more on the topic of hormones, so do stay tuned for that. But generally, most women, and you've all experienced it, I know you have, and hello Daniela, hello Joe, and you've all experienced it, and it's those period breakouts. Now, some women get it around ovulation, some get it just after, maybe a few days before their period, and some people just get it when their period occurs. So this is to do with the progesterone and the fluctuations of the hormones. It's completely normal, honestly, to get these breakouts around this time of the month. It's just, are they unhealthy and are in abundance? If they are, we've got something to pardon me, something to look into. So we've also, pregnancy, coming off of the pill. This is really, really prevalent. Young women in their 20s will come off the pill and their skin will just go rah, and it's usually because they've been on oral contraceptive pills or hormonal contraceptions from a young age, and their body just isn't used to kind of doing it itself, so it all kind of becomes imbalanced. And hello Meg. So it's very, very common for this, and honestly most of the women that come to see me, they've just come off the pill and their skin has gone terrible, and they're like, what do I do? So it is one of the causes, and depending on where your hormones are at, what you're most susceptible to, because there's a lot of different things that can happen with the hormones. And depending on your particular situation, it'll change. Now, very commonly, I don't really have the medical backing to talk about this, but I will kind of mention it. This is something I've heard over and over and over again, but definitely speak to your doctor about all of this as well. But generally, a lot of doctors, they tend to tell you, they'll do a hormone test and they say everything's running fine, but that sometimes might not be the case, and it might take a little bit more further investigation and perhaps doing several different, not just doing one hormonal test, but testing it over a period of time and retesting it and kind of delving a little bit more into it. This is why I like naturopaths. They really get to the root cause, and they kind of broaden their scope essentially, and they look at things a little bit more in detail. So we've also got inflammation essentially. So inflammation on your skin, inflammation within your body. Hello Eloise, thank you for watching. Just check, whoops, messing around with Instagram there. Shouldn't be touching the screens, they're balancing very nicely. So there is many other things. So we're talking over exfoliation. This one's a huge one. So when you over exfoliate or over cleanse or strip your skin, you are essentially bringing down your skin's first line of defense, and then essentially impairing your acid mantle. So I'm going to always bring it back to the acid mantle. Now, it's essentially your skin's first line of defense. So your skin has lots of layers, and right on the top is your oil. The oil that you produce that comes in through the hair shaft up onto the top layer. Now, it's not just because the oil's been wiped, your skin is still going to produce these oils, but what happens, whoa, it's a bug. What happens is the skin cells and all the processes start to become impaired. So it's not just one process, it's a lot. So it's an impaired acid mantle essentially, and we have to heal that first. We've got polycystic ovary syndrome, disease I should say. That is a huge, whenever somebody has that, there's quite often a tendency for acne. We've got different types of drugs. So I'll just quickly go back to the polycystic ovary. It's not just polycystic ovary syndrome. There's many other diseases of the body that can cause it. This is just a very common one. I quickly wanted to mention it, and it's to do with testosterone. And I'm really simplifying it by just saying testosterone. It's a lot more complex than that, so that's not doing it enough justice. But that is one of the causes. So different kinds of pharmacological drugs. So we're talking steroids, hormones, anticonvulsants, epidermal growth factor, receptor inhibitors, and many, many others. We've also got application of occlusive cosmetics. So we're talking mineral oils that can be a little bit clogging, or we're talking about, oh, I think Instagram is not working. Never mind. We've still got Facebook. So yeah, there's a lot of things that can really start to congest your skin, and this can be very individual, and yeah, there can be a lot of things. So this is something we usually discuss in your treatment. It can be to do with makeup, it can be to do with sometimes the least thought of things. So I think I'm just going to quickly end Instagram. Doesn't want to work. So it's just you guys, Facebook. So yeah, so it can be to do with a lot of things. Some of the most common ingredients are petrolatum, vegetable oils, butyl stearate, lauric alcohol, and oleic acid. That's just some of them that were listed, but I'm sure there are many, many more. I don't tend to focus too much on the ingredients because it's not always consistent. I focus on kind of like a process of elimination. High environmental humidity. This is a really interesting one because it can kind of go both ways. So generally, in a humid environment, you're having oops, what's going on here? So many, Mum goes, so many big words. She's commenting on my video. Thank you, Mum, for being my fan, my #1 fan. So in a humid environment, we're holding a lot more water in the skin, and sometimes that can kind of be a precursor to congestion, essentially. But then it can kind of go the other way. So if you're in a really, really dry environment, you're more prone to losing water in the skin, which is more prone to a impaired acid mantle. So it kind of goes both ways. So a diet high in dairy products and sugar, like I mentioned, diets low in zinc or high in iodine can worsen acne as well. So there's a lot of things, and I've probably missed out, but this is just a list of things that can cause or aggravate acne. But essentially, acne is a condition of, it is internally driven, and it is also topical. So this is something I talk to all my clients about, and it's about understanding that this is an environment on your face. This is a topical environment. It's got its own microflora. It has its own functions. It's its own organ, essentially, your skin. But then you have your other ecosystems and environments in your body, like your gut and your hormones and your nervous system, and all of these different systems all work in cohesion and are always trying to find homeostasis, so balancing within the body. And they're working all for the same thing, to essentially protect you and live on. So the good thing is that, yeah, acne is it is topical, it is internal, but we can really, really do a lot topically for you in terms of in-clinic treatments when it comes to skin therapy. So that's why I'm able to get a lot of results for you, because we can change this environment, and then we can start to talk about lifestyle changes, get you onto a good naturopath or a doctor to get those results for you. Now, I wanted to kind of end this very intense first session of this acne series by talking to you about, and really, I just really want you to understand this and kind of, yeah, ingrainedly understand this, because I've never heard anyone talk about this, and I'm sure this is a topic of confusion for a lot of people, is that depending who you speak to in the industry, whether it be the beauty industry or the medical industry or whatever, someone will give you a different opinion on acne and how to treat it. Now, there is a reason for this, and that is not because one is wrong and the other one is right. That's not true at all. All these people, they're all in caring professions, and they all want to help you, but they've all got different backgrounds of study. They've all got different biases, so reasons to be recommending this particular application of therapy, essentially. They've got a different way of looking at it because they've specialized in something, and kind of almost different kind of, I don't want to say ethics, but kind of core beliefs when it comes to treatment. So, you know, the people you might speak to about your acne, maybe you'll speak to your doctor, maybe you'll speak to a dermatologist, maybe you'll speak to a naturopath, perhaps a nutritionist, or perhaps you will speak to a beauty therapist or a skin therapist. Now, all of these people will treat acne differently, and this is what I really want to kind of dive into to give you an understanding of how all of these components, they aren't wrong, but they have a time and a place, and can sometimes be a little bit misguided because they're not kind of considering all the factors. So that's why I am so passionate about learning more and more and more about the topic of acne, and not just thinking in a topical way, because that's what I can change, is the topical environment, but I'm really concerned about understanding all the pathological processes. Like I said, my brain's not working today, guys. So I want to understand them all because I want to give you the best advice. So I'm going to talk to you about what doctors do. So essentially what a doctor will do, and we all know doctors, they only have really, really limited time. So they go, oh, you've got acne. Okay, so I can help you with that. And generally doctors are going to treat with pharmacological medications. So we're talking oral drugs or pharmacological topical treatments. So active ingredients of some sort. So generally what the doctor will do will think about your hormones. They'll think about, I've got this all written down. They'll think a little bit about the P. acne bacteria, and they'll think about the sebum production. So what they will essentially do, if you're not on a home oral contraceptive or a hormonal contraceptive, they'll want you on one ASAP. And that's because it does tend to give you quick results, but that's not the wish for everyone. Not everybody wants to be altering their hormones through this therapy, but that's generally what they will say. Some of them I found don't tend to they're very stuck in that way. Well, if you don't want hormonal contraception, what else can we do? That's when you know you've got to go find a new doctor. But generally most doctors are pretty good. Another thing they might prescribe is NSAIDs, so non-steroidal anti-inflammatory drugs. So anti-inflammatory drugs, that's not as common, but can be, because there is that inflammation component. They will also treat the sebaceous gland. So I was talking about the SIBO site before. Well, they will tend to treat this sebaceous gland, but in my opinion, this is doing it very harshly and almost a little bit counterintuitively. Not almost, quite a lot. It's very counterintuitive. So they'll treat the sebaceous gland with Accutane or isotretinoin. So this is a oral drug that you actually take. It's kind of like a potent version of vitamin A, and what it will do, it'll really halt the sebum production in your skin. Now, you remember how I was telling you guys about the acid mantle? The acid mantle, it can get impaired and it's your skin's first line of defense. Well, if your skin's not producing oil, then what happens to your acid mantle, right? Well, it's essentially going to be impaired. And then if your acid mantle's not there, what's happening to the water in your skin? It's just free floating out. It's called transepidermal water loss. You're losing it. And then what happens when the water leaves your skin? Your enzymes aren't working, so they're not eating up kind of the dead skin cells. So the desquamation process starts to be impaired. The corneocyte compaction becomes impaired. All these processes become impaired, all due to the acid mantle. So why are we doing this? Why are we stopping it altogether? Now, it is a quick fix. It absolutely is, because generally acne, one of the biggest things is to do with the sebocyte cell, and the best thing you can do is kind of just get rid of it altogether. But that's the quickest thing you can do. Sorry, it's not the best thing, it's the quickest. But it's not helping in the long run, and generally people will come off of Accutane and they'll get the condition right back. So it's a quick fix, and a lot of people will go down that line. I'm not saying it's bad. If your acne is very, very, very bad, it might be an option for you. Speak to your doctor about that one, but generally I would recommend preserving the integrity of your acid mantle at all times. This is really, really serious stuff, because if you are going to take Accutane, it means your skin is very, very prone to being sunburnt. It's just very sensitive and dry skin, and it takes a long time to come back from that. So yeah, it's kind of a last resort in the way I like to think of it. They will also, isotretinoin or Accutane will also treat, it helps with the follicular occlusion, so it stops the sebum from getting blocked in there, essentially by stopping the sebum, and it obviously inhibits the growth of bacteria because they've wiped out the environment for the bacteria to even be there in the first place. So that was the P. acne bacteria, which is one of the causation factors, and it also has anti-inflammatory properties. So this is one of the ways that they'll treat acne. Another way is by prescribing doxycycline or erythromycin or minithmycin or trimethoprim. Oh goodness, I can never say the long pharmacological drug names, but essentially antibiotics. So they'll treat acne with antibiotics in hopes to wipe out the P. acne bacteria, which is a causation factor of acne. But once again, you know, why are we doing this? If we're wiping that, like that P. acne bacteria is there for a good reason. It's there to serve a purpose. And as soon as you get rid of that, you're kind of impairing the rest of the processes. So it's not going to be a long-lasting result. We all know this. Most people that go into doxycycline or antibiotics for a period of 2 to 7 months or even 12 months sometimes, they'll get the acne back. And just by getting rid of the P. acne bacteria isn't going to fix it in the long term. We need to treat the other causation factors. It's also anti-inflammatory, so that does help in a sense. But that is one of the things that they will do. And yeah, I guess that runs the risk of what is the way to say it? I am very, very tired. My words are leaving me. Antibiotic resistance. So that is something to think about, and not something I can advise you on, but definitely a topic worth researching in your own time. So I don't really like the idea of being on an antibiotic for 6 months to 12 months, but it is very, very common and it's commonly prescribed. We also have, so doctors will tend to treat hormones in a different way. So they'll treat basically hormones with anti-androgens. So depending on your hormonal situation, they will treat different pathways essentially. And they will always, or most likely, I hope that they would be recommending a topical applications as well, but it's not always true. Sometimes they will just go, take the doxycycline, this will help you, or take the Accutane without any kind of advice on skincare, because this is a huge part. We've got to be treating everything in. It's a multifactored approach. So sometimes they will talk about topical applications, and they will generally prescribe things like QV or Cetaphil, which are very, very plain pharmacy brand cleansers and moisturizers with no fragrance, are very gentle, but they also have their own issues. They'll definitely prescribe a benzoyl peroxide or a hydrogen peroxide. Now, I'm not a fan of these. Once again, they do provide good, quick, immediate results, but they are impairing the skin integrity, impairing that acid mantle once again, and they're very, very harsh. So I find them counterintuitive, but a doctor will tend to prescribe them. They'll also potentially prescribe you a retinoid treatment. So this is a pharmacological topical treatment, and it's the active ingredient, again, the vitamin A, and it could be called retin A or isotretinoin, adapalene, different. Really just depends where you are in the world. But you have to be prescribed if you're here in Australia. Now, retinoids actually play a really important role in treating acne, and I will go into that on another part 2 or part 3, however many parts we need to do. However, in the form of the topical ones the doctors prescribe, they're very, 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 very strong, and again are very impairing on the acid mantle, so I don't recommend them. A dermatologist will pretty much follow this exact same protocol I've found, but it really just depends again where you are in the world, and also kind of the values of the dermatologist. Now, different dermatologists will have access to different things. I've been to them myself, and it really just depends on what their interests are, how old they are perhaps. But we are seeing a a surgence of dermatologists in Australia kind of following the ways of the American dermatologists, where they are actually thinking a little bit more about active ingredients and skincare. So they're not just kind of sending you to the pharmacy and prescribing QV and Cetaphil and these very generic brands that potentially have harmful product ingredients in them that aren't helping the entire cause. They're thinking a little bit more outside of the box. I haven't met one in Adelaide yet, they still, the ones that I've seen in Australia still tend to recommend pharmacy type brands like La Roche-Posay, and I'm not saying they're bad, but they don't have all the answers when it comes to topical skincare for treating acne. Whew, that's a lot to go through, guys. I'm going to talk a little bit about naturopaths and beauty therapists and skin therapists, and this is where I'm going to leave it and then get onto the Q&A. But I want to talk to you about how these all differ from doctors and kind of the thought processes behind them. So the doctor is wanting to treat, they're looking at the research, they're looking at the recommendations and the standardized treatments. And what I just mentioned is the standard treatment. And it essentially will give you some results or maybe none at all. And it's really only treating one side of the whole picture. So yeah, I hope that kind of makes sense to you guys, and it kind of opens your eyes to understand why maybe you never got results when you spoke to your doctor, and kind of understanding why they prescribe these things. So a naturopath. Naturopaths are natural medicine doctors, and you'll find that their opinions can sometimes be very different to a normal doctor. It's because they have an affinity to natural therapies. The reason why I love doctors as well, don't get me wrong, but I really like naturopaths because they're more about preventing disease and treating a little bit more holistically. A doctor will prescribe and treat by prescribing, whereas a naturopath will tend to give you a little bit more time in your consults and really kind of dig deep and do a lot of tests. So generally, naturopaths are interested in understanding your entire health, and they're wanting to find out where your vulnerabilities are in terms of inflammation, what's going on with your hormones, what's going on with your gut health, and they really are delving deep. I really like this, but then I feel that sometimes they have it really just depends. I'm generalizing here, guys, but I find that a lot of them kind of are a little bit scared of using topical active skincare as well. They're more wanting to treat in the more natural way, saying like using apple cider vinegar on the skin, which can in fact give you a chemical burn, or things like coconut oil. So these things aren't so good for acne, and I find sometimes naturopaths will recommend those things, and that's just because they have an affinity to natural health. But generally they can get you a lot of good results, particularly with nutrition advice, and really delving into your health and finding a little bit more out than a doctor will generally. Depends on your doctor, guys. If you're seeing a good doctor, they should be doing these investigations. So they will generally look at a really wide scope. They'll do your blood tests and they'll go, all right, well, how's your thyroid, how's all these things, and really try to get to those. And they will treat that by prescribing you supplements and lifestyle advice and all of that, which can be really helpful. And then we've got, that's pretty much it for the naturopaths. And then we've got skin therapists and beauty therapists. And now this is my scope, this is what I do, but all beauty therapists were not created equally, and they do not treat equally. This does not mean that one is better than another. It's not what I'm saying. I'm just saying we have different histories when it comes to the industry. So depending on it really just depends on the particular beauty therapist and what the interests are. Are they interested in skin? As you can tell, I am. I've done a lot of research, and I will continue to. I'm always educating myself. But maybe another beauty therapist, they maybe have only been in the industry for a little while, and perhaps all they really know is what the brand representative for that skincare company in their clinic that they work at has told them, and they will generally say this will treat acne, this will treat acne, and this will treat acne, and perhaps they don't understand the full story of why these products are going to treat the acne. Maybe they'll get lucky and they'll get you some results, but maybe they don't understand the rest of the things that we've just been talking about, and that it's just the way it is in the beauty industry. It's not their fault, it's because they haven't been taught the entire, you know, when it comes to this industry, we really have to self-educate. We only get taught so much, and it's really up to the therapists themselves to educate themselves and really take it as far as they want to. So they will, depending on the therapist, you'll get a different level of service. But there's different types of beauty therapists in the way they treat. So a lot of beauty therapists will treat with the intention of taking away from the skin. So they're essentially have this idea that acne is really just an excess keratinization problem, so an excess skin cell problem. And they are really, really focused on using microdermabrasions to get rid of the skin cells, and you know, doing lots of peels on the skin because we need to get rid of the congestion, but that doesn't, it's not the whole picture once again. So it's kind of like taking away from the skin and again impairing the acid mantle, whereas myself and therapists, corneotherapists like Kai and Mary and Robin McAlpine and many others out there, we really focus on putting back to the skin and repairing the acid mantle. It really depends on the therapist, it really depends on their education and the skincare line that they've stocked, but essentially beauty therapists, what we can do, we can treat topically and then advise on lifestyle. Now I do want to kind of end with this and kind of get you thinking. Now, who has the most on the line when it comes to treating acne? So in terms of, if they don't get you results, what, you know, they're going to get backlash. There's going to be a negative result or a negative outcome, essentially. Now, doctors they don't really have that kind of negative backlash. They don't really, I mean, they obviously have a responsibility to their client to look after their patient, to look after them, but essentially they can just say that, well, I'll just prescribe you more, or it's not completely known that all the causation factors of acne, but that's because they're only treating one part. So they don't really have too much backlash if they don't get results. And that's the same with naturopaths because they're treating the internals as well. But beauty therapists, we are the ones that have a lot of responsibility on our shoulders because we are the ones saying that we're going to help you. And if you can't give results to someone who you're telling them you can give them results, then that's going to come back on you as a beauty therapist. Now, that's a lot of responsibility for a therapist, but it also commands a lot of high work ethic, essentially. So this is my belief, this is my personal belief, this is why I think a lot of beauty therapists and skin therapists can actually get you a lot of good results. It's because they really take responsibility. They understand, depending on the individual, they understand that it is multifaceted and we've got all these different things to treat. So, and they know that if they're going to tell you that they're going to treat something like acne, they're really going to put their heart and soul into it, and they will consider all these options. So they're treating this topical environment. Now, I could potentially treat someone topically and not get them the results they want. I would definitely get them results, but we might not get them to complete clear glowing skin like they maybe envisioned in their mind. And that's because I can't treat your internals, but this is where the communication comes in. And I guess what I wanted you to understand is beauty therapists, we're in a service-based industry. A lot of our clientele is based on reviews and good feedback, so we have a lot of responsibility to give you great and amazing results. So that's kind of why beauty therapists, we are treating topically, but we tend to treat a little bit more holistically and refer out and are wanting to get get you the results. And maybe it's because we're a little bit more in touch with our hearts perhaps, and we can really feel your emotions, and we really want to get you the results. Let me know if this sounds about right to you guys. I've never actually heard anyone else say this. This has just come from my mind and my beliefs on the topic. But this is why I think seeing someone such as myself for treating acne is a great thing, because we are considering so many things about your skin. And yes, it's really, really important to remember that, of course, as a beauty therapist or skin therapist, we are going to be prescribing you a topical treatment, which is from the skincare line that we stock in our clinics or spas or whatever. And that is for a good reason. It's because we need to put something onto your skin, active ingredients to change the way your skin's behaving. Those active ingredients in these skincare lines that are active and only sold in clinics, such as Dermavigilals is the brand that I promote and use and love. Those amount of active ingredients just really, really aren't found in pharmacy brands, and they can't really be sold over the internet because you need a certain level of understanding to be able to prescribe them, because they are active and they can really change things on your skin for better or for worse. So yeah, that's what a beauty therapist will do essentially. And someone for myself, I wanted to kind of just end this whole broadcast by telling you about how I treat acne in clinic really, really briefly. But basically for all consultations, not just acne, I give you a 1 hour to 90-minute in-depth consultation, just me and you sitting and talking about your skin, your health, your nutrition, your lifestyle, your upbringing, your everything, what you've been doing topically, everything. I really want to find out all the nitty-gritties, because sometimes it's just that one little missing piece, and we can really start to formulate a plan. So I think that is really, really important, because we need to address everything. And at the moment, I've just released a new treatment. So at the moment at Soul Awaken, I've been treating, basically I offer slots of time, so you can book in for 45 minutes, 60 minutes, 75 minutes, or 90 minutes, and I create a bespoke treatment for you. But I've officially come out with my first kind of condition-related treatment, and that's because I've been perfecting how I treat acne. And I've come out with a facial called the Express Acne Facial. Now, it's still bespoke, it's still customized and tailored, of course it is. I couldn't just give you a blanket approach, because that's not the way to go about it. But basically I've created this 45-minute treatment that is designed to be done fortnightly, and it's kind of could be done about 6 to 8 times. It's going to include extractions and enzyme exfoliation, repairing your barrier with good active ingredients, putting good actives into your skin to help change the acne essentially, and a nice customized mask. So I've just released this new facial. It's for 45 minutes. The normal price is $99, but I've actually bundled them into packages of 4 with a really significant discount. So if you are interested, I'd love for you to just comment below in this video and tell me yes please, or give me the info, or whatever you want to say. Let me know and I'll send you the information and the details on this package. It is seriously a very, very good deal at the moment. I've heavily discounted it, and yeah, it's very beneficial. It's what I've been practicing and what's worked for me. So I wanted to create that facial, and it's done in a really quick time, which I'm very happy and proud of. So I didn't come on here to promote myself, I actually came on here to educate you. So I hope this has really helped. If you have any questions, this is the time. This is where the Q&A happens. I'm definitely going to have to go more in depth on future sessions when it comes to this topic, because today like I said, we've scratched the surface. We haven't even delved into the nitty-gritties of hormones. We haven't delved into more so about the sebum in the skin. We haven't delved into so many things, how to treat acne, and some of the other things to do with impairing your barrier. So I'd love to meet you all next week. Same time, I will be still here I'll be actually in Brisbane, and I will be after a skincare training, skin education training, and I'll be very tired once again, but ready to, yeah, talk to you all about it. So, and hello, Georgiana, sorry, couldn't say your name, Georgiana, and Justine, hello, and hello Brianna, it's nice to see you here. So if there's any questions, definitely pop them down below. I'm just going to hang around for a few moments. But yeah, I'd love to hear what you thought of tonight's session. My mum has commented saying, so many big words, you know. I know there is, and I really am trying to simplify it. I've simplified it quite a bit throughout this talk, and I feel like that sometimes takes away from giving you all the information necessary. Oh no, here comes a yawn. I'm so sorry if you catch it. I'm not seeing any questions come through, so I think I'm going to leave it at that and let you all my eyes almost just drooped then. Oh goodness gracious me. What has Stephanie said? She said she loved today's video. Oh, that's fantastic. Thank you for the feedback. Sometimes I'm not sure whether my message has been come across right, but I'm really wanting to be very, very comprehensive. You have to watch it later from start once you finish. Yes, absolutely. I'll share it on this page, and I'm going to pop onto my YouTube when I get back to Adelaide. I do think I would like to create a more cohesive and concise video series on the topic, maybe doing 8-minute videos on every tiny topic. So this would be like a ton of videos, but this is a long-term goal, so perhaps I'll do that eventually. So yeah, I hope you enjoy the replay. Anyhow guys, it's been lovely chatting with you all here. I'm excited to meet with you all next week. If you have any friends or family who's needing some treatment here in Adelaide, I'd be happy to look after them. If you're not in Adelaide, definitely let me know, and I can recommend your friend or family member to somebody who I know that's in the industry and who I also believe is amazing and will help you. With all that being said, it's time for me to take off my makeup and get to sleep. So have a really nice night, guys. Bye.